I'm Ilona Velarde and today I'm interviewing Dr. David Dighton, a London and Nicosia-based cardiologist. Welcome, David.
Thank you for inviting me.
Today I would like to ask you about heart failure.
Well, heart failure is common mostly in older people. It's a weakness of the heart. That's what we mean by heart failure. The heart is a pump and it's not pumping quite so strongly, so patients get symptoms from this.
What are the symptoms of heart failure?
Well, you have to understand that the heart has two sides, a right side and a left side. If the right side is weak, patients get swollen legs. If the left side of the heart is weak, they get breathlessness because blood cannot go forward, so it dams back into the lungs, so there's not enough room for oxygen, so they get breathless. But they can also get cold hands and feel very tired because not enough blood is being pumped. So the commonest symptom really is, apart from swollen legs, is breathlessness. Now, a lot of people get breathless, obviously, if they're unfit, they're overweight, so lots of people get breathless. But if they get breathless rapidly, or they can't lie flat in bed, then that is a sure sign that their heart is probably weak.
And is the breathlessness as asthma?
Yeah, well, we actually call it heart or cardiac asthma, and this occurs mainly at night. But patients will have to sit up in bed, they cannot lie flat, some of them, and they will wheeze. So yes, it's very much like asthma, and doctors can make a mistake here. They may think it is what we call bronchial asthma, which can be due to allergy or almost a lifelong condition, when it can actually be their heart. And it's quite a bad mistake to make, because the heart failure type of wheezing or asthma is far more serious in a way.
Swollen feet, does that always mean heart failure?
I'm so glad you asked me that question, because a lot of doctors in the past have assumed that swollen legs mean heart failure, and it just is not the case. The commonest occasion where we see swollen legs is older people sitting for a long time, and because of gravity their feet will get larger. It happens to young people in hot weather as well. If they sit too long, their feet, due to gravity and the heat, will make their feet swollen, but that is not heart failure. Unfortunately, some older people are given tablets for heart failure when they do not have heart failure, and that can make them very ill indeed. So a very good question. No, the answer is no. Swollen feet does not, or in fact it only rarely means heart failure. Most people with swollen feet are just sitting too long.
Do young people get a heart failure?
Yes, they do, but it's a very specialised subject, this. We call it congenital heart disease, where there are holes in the heart or where the arteries are in the wrong position. There's quite a lot of very rare conditions which only paediatric children's cardiologists see. So in general, we general cardiologists and doctors in general don't see it. It does occur, but it's very, very specialised. And I think a lot of these children are sick, and some of them are actually blue, and they're not thriving, they're not growing as they should. In those rare circumstances, it's essential that the child is seen by a child's cardiologist to make this diagnosis.
So what are the causes of weak heart in adults?
Well, it's mainly in older people, of course, because the heart gradually develops scar tissue. This is a natural process, an aging process. So it's a bit like the difference between when you eat lamb, an older sheep will have chewy muscle, and a lamb will have very soft, easy to digest muscle. The same thing happens in the heart. It becomes new, young muscle turning into scar tissue. We call it fibrous tissue. And if you were going to eat it, it would be chewy, but of course it makes the normal heart cells, which do the contracting, turn into scar. So there is just not enough muscle to squeeze and pump. That is probably the major cause, but of course coronary artery disease with a reduction in the amount of blood going to the heart also does it. And then you have what is now getting rarer, conditions where the heart valves are either narrowed or they are weak, they are leaky, and this can cause the heart to become larger and weaker as it stretches.
And are heart valves much of a problem these days?
Not as much as they were when I was a young doctor. I was educated in an era where people had rheumatic fever, which is a strange condition, but it caused the valves to become leaky or narrowed, and a lot of those people went on to have heart failure. It does occur still in third world countries. It's not quite so common in Europe. It occasionally occurs when somebody's heart starts to stretch and dilate, and then that makes the valves a bit looser and perhaps regurgitant, as we call it. They become incompetent, and under those circumstances it is an effect of heart failure rather than the cause of heart failure.
And does the heart change in any obvious way?
Yes, it does. It becomes much larger. The heart becomes larger in high blood pressure as well, but that is thick muscle causing the increase in size. But the worst thing is when the heart dilates like a balloon, and it can't, when it's really large, it finds it very difficult to squeeze. A small heart can squeeze quite nicely, but the larger it gets, the more difficult it is to squeeze. It loses power, which is heart failure.
The muscle and the heart size then both are very important.
Yeah, they are. They're both the components of heart failure. As I said, that if the muscle becomes scarred, it becomes weak for that reason. And then taking the heart as a whole, the larger it becomes, the less able it is to squeeze. Imagine a simple example. If I said to you, squeeze a tree, you can't really easily squeeze a tree. But if I said squeeze this, you can get your hand around it and cause tremendous pressure. The same thing happens to the heart. When it's large, it just can't pump very well. But when it's small, it can produce a lot of pressure and a lot of flow. So heart failure is associated with a stretching heart. We call it dilatation of the heart. You can see that on an X-ray, you can see it on an echo sounding. But that's probably one of the commonest changes in the heart with heart failure.
This heart weakness can be treated?
Well, I've actually seen in my time as a doctor an enormous revolution. When many years ago we used to only have what we used to call water pills or diuretics, which made people pass salt and water in their urine. That helped a bit. And then we had some tablets which slowed the heart and increased its muscle strength a little bit. And then these were very unsatisfactory treatments. And then about 25 years ago, somebody invented something called an ACE inhibitor. And these made an enormous difference both to people with high blood pressure, because it lowers blood pressure, and to heart failure. What happens is the pressures in the heart drop, making the heart more able to pump. So yes, ACE inhibitors, and there's a further invention or pharmaceutical invention which the drugs all end in sartan, losartan, candesartan, which also do the same thing. They have made an enormous difference. You can take a person who can hardly walk 50 meters, is able to be almost normal. It's only temporarily, of course, because the heart still stays the same. But in terms of the symptoms, an enormous improvement with these drugs.
Do diuretics have side effects?
Yes, so they're commonly called water pills because they make you pass more water. They actually make you pass more salt. And the trouble with that is they can lower your blood pressure, because salt equates to blood pressure to some extent. And in older people, they can really take all the water out of their system to an extent where if they're given for swollen feet, the feet remain the same, but the blood fluid shrinks down to the point where the blood pressure drops. They start to faint and feel ill. So there are really very serious side effects in older people. In younger people who are drinking plenty and they're moving about a bit, that's okay, they probably are okay. But if you're an old person sitting in a chair waiting for a nurse to give you something to eat or to drink, they can even kill you, I think. It doesn't happen that commonly, but it can certainly make people very ill indeed, yes.
It sounds a bit complicated. What tests do you need to do?
Yeah, it is a bit complicated because the detection of heart failure depends on a number of difficult signs in the heart. You know, sometimes we look for the fluid levels, we listen to the heart. It's not an easy job, and unless you're doing it all the time, it can be difficult. So nowadays, we rely on echo sounding of the heart to show how large the heart is, how well it's contracting, what the valves are doing, are they leaky, are they narrowed. So ultrasound is probably the simplest key test, and that will confirm whether or not it is heart failure or whether the feet are just swollen due to heat or sitting. It's an important test to do in older people.
Is breathlessness the most important sign of a heart failure?
Yeah, I'd say it was, yes, especially if it's at rest, especially if the patient gets breathless when they lie flat. That's a very good sign of heart failure, although it can be asthma as well, and that could be a difficult thing. But yes, increasing breathlessness on walking, it's pretty noticeable by patients. Some of them say, oh, it's my age, it's my weight. They don't get the idea that it may be their heart. They may worry that it is and be worried to see a doctor. But it's important because we can step in early and give good treatment. So yes, in answer to your question, breathlessness is one of the most important. The swollen feet, which can be a sign, is misleading because most people, as I said, are just because they're sitting around and it's hot. It's not that good a sign of heart failure, not as good as breathlessness. Let me illustrate a normal heart beating on echo sounding and a heart failure heart beating. You can see that the heart failure heart is much larger, dilated than the normal one, which is small and strong.
This is Ilona Velarde saying goodbye for now. Please note that our other videos explains about other heart symptoms. And you can also download this very short brochure, Worried About Your Heart, which explains many details about heart problems and which is available in 4 languages: English, Greek, German and Russian. Don't forget to purchase our HeartSense supplement, which is essential to even the best diet. Soon we will also have HeartSense tablets, which will be available on our websites. All our products and information are available on our websites, heartsense.com.cy and the cardiaccenteruk.co.uk.